name is Megan Hoadley, and I'm a speech-language pathologist at HealthPoint Outpatient Therapy in Wooster. As a speech therapist, one of the populations I treat include individuals who are picky eaters. There are many misconceptions about picky eating. One misconception about picky eating is that it's behavioral and children will grow out of it. While that is true for some children, 50 to 66% of children continue to have eating problems that persist into adulthood. Others believe the misconception that if a child's hungry enough, they'll eat whatever you give them. While in reality, feeding difficulties stem from sensory aversions to texture, delays in chewing skills, swallowing difficulties, and many other medical impairments. We utilize the SOS approach to feeding, which is a multi-sensory approach where our patients learn about food and work to increase their food repertoire. There are many ways to interact with food. We encourage our patients to use all their senses to learn. This helps them become systematically desensitized to the fear response of non-preferred foods. This looks different for each patient. We use a play-based approach with our younger kids or with our teenage to adult patients. We provide guidance and counseling as they work through the steps to eating. If you or your child find trying new foods to be difficult, avoid a certain food group, or eat a limited number of food, reach out to speech therapy at HealthPoint. We are here to help. Happy eating!